Hi dear viewers, good evening. I hope you all are doing fine. I'm Gauri here with you. Welcome to yet another fresh episode of BMC Global Live AL-HILAL Health World. As we move on to the talk, please do not forget to like and share our Facebook page. Also like, share and subscribe our YouTube channel. So in our last episode, we had talked about braces and retainers and also how to maintain our oral health when we have these. So today's episode, we'll be starting it by talking about the oral hygiene in children and infants. So to provide knowledge on this, we have a very charismatic and skillful doctor, Dr. Rinkoo. He is an orthodontist specialist working at AL-HILAL multi-speciality medical centers and hospital. He has done his graduation from JSS Dental College, Mysore, and has taken his master's in orthodontics at AB Shetty Dental College, Mangalore. He is also an international member of American Association of Orthodontists as well as a fellow of World Federation of Orthodontists, and he has successfully made his mark in Bahrain within a very short span of 5 years. Hello doctor, once again welcome to the show.
Thank you so much, Gauri.
I hope you're doing all good today.
I'm doing great. How are you doing?
I'm doing great too, doctor. So doctor, I've met a lot of children like infants.
Okay.
I have a lot of cousins, so I've met them and I've noticed that most of them have their first teeth erupting at 6 months or maybe after that or maybe at 1 year when they are 1 year old. So what is the exact age for a child to have their tooth erupted first?
See, the first tooth or the first milk tooth to erupt into the oral cavity is your lower front tooth, and it is followed by your upper front tooth. And this usually happens around the age of 6 months.
Okay.
And by the age of around 2 years, the complete set of milk tooth erupts into the oral cavity.
So doctor, I've heard of this term called as teething. So what is the meaning of this term?
See, teething is a process by which a teeth erupts into the oral cavity or by which the teeth breaks through the gums. And in children, some of the signs and symptoms of teething can be crankiness, irritability, a loss of appetite, trouble in sleeping, an urge to chew on objects, and even mild fever.
So I've seen that when these babies are born, we usually hire a third person to take care of them. So is there a need for taking care of the baby's teeth?
See, oral hygiene in kids or infants is something which is neglected by most parents these days.
Yeah.
It is definitely equally important as personal hygiene.
Okay.
You need to take care of the oral hygiene after every feed and before the baby is put to sleep. From the age of about 3 months, you can start this by wrapping a wet cloth or a gauze around the finger of either of the parent and running it around the gum areas and the newly erupted teeth. And starting from the age of about 1.5 to 2 years, you can use a specially designed toothbrush for kids, and the parent can brush it for their kids until they are mature enough to start brushing on their own. Once they are mature enough to start brushing, the parent must encourage and support the child and make sure the child brushes and completes the whole process. And this can be done by specially designed toothbrushes and toothpaste specially formulated for the kids.
Oh, okay. So I've seen that tooth decay, it takes place in adults. So can it take place in children? If so, how can it be prevented?
So one of the most common kind of caries seen in kids is called as nursing bottle caries or rampant caries. So this happens when the baby is put to sleep with a feeding bottle in the child's mouth. So what happens is, throughout the whole period of the night, the teeth is coated with milk. So when this happens every day for a long period of time, it leads to nursing bottle caries. So what I would recommend is you need to give water after you feed the child, or if the child is still awake, you can run the gums and the teeth with a wet cotton wrapped around your finger and help prevent this nursing bottle caries.
Okay, so doctor, in adults again, I've seen that while tooth decay takes place, we usually fill the tooth. So is that done for babies or can it just be left like that because anyways it will fall off and a new teeth is going to come?
Again, that is another myth happening, that you neglect cavities in children. They say though it's eventually going to fall off, why bother filling, or you can just pull it off. But cavity in children or a decay in a milk tooth can lead to developmental disturbances in the permanent tooth, because cavity can lead to an infection, which in turn affects the development of your permanent tooth. And the other thing, extraction. If you remove the teeth, the role of the milk tooth or the primary tooth is not played by anyone else. So what happens is the speech is affected, the eating habits, the aesthetics and self-confidence, and moreover the space for the permanent tooth is lost, because what happens is the adjacent tooth moves into the space of the lost tooth.
Okay. So doctor, with that I think we'll go for a short break now. So dear viewers, we'll be going for a short break now. Please do not forget to like and share our Facebook page. Also like, share and subscribe our YouTube channel. We'll be back soon. Welcome back dear viewers, you are listening to BMC Global Live AL-HILAL Health World. With us we have Dr. Rinkoo Jose. So doctor, in our previous episode we had talked about the habits in children. What are the common habits that we can see in children?
See, some of the most common habits seen in children are thumb sucking, tongue thrusting and mouth breathing.
Yeah.
Thumb sucking is completely normal up to an age of 3 or 4, but after that if it continues, it leads to defects in the placement and positioning of the teeth. So by placement I mean it leads to protrusion of the teeth, and it can lead to an open bite. Open bite means the lack of touching of your upper and lower teeth. And the same goes with use of a pacifier. But with the pacifier you can take it off from the child, but with the thumb the child is stuck with the thumb. And the second most common habit seen is tongue thrusting or reverse swallowing. So in this process what happens is the child sticks their tongue between their teeth when they swallow. So this is normal at a small age, but if it continues even after the development of the swallowing pattern, this again leads to protrusion of the teeth or spacing out of the teeth. And the third habit being mouth breathing. But mouth breathing has an underlying cause, that maybe the child has an infection, infected tonsils or adenoids or any other nasal obstruction. The child is forced to breathe through the child's mouth throughout the period of the whole night. So what happens is this in turn retards the development of the lower jaw and the nose and a lot of other factors, and it leads to a typical adenoid facies, which we say. And what happens, it causes an open bite and a protrusion of the teeth.
So how do we treat these habits? How can we prevent the child from doing these?
See, we can use certain appliances known as habit breaking appliance. So as the term suggests, it breaks the habit. So there is, for thumb sucking and tongue thrusting, the habit breaking appliance, it's fixed to the molars, and a thin wire runs behind the front tooth. So this stops the child from placing the thumb into the mouth and also bringing the tongue forward. Whereas to treat mouth breathing, first the child is advised for an ENT consultation to rule out or treat the underlying cause. And this should be followed by a consultation with an orthodontist to reverse the ill effects what has happened through continuous mouth breathing.
Okay doctor, so now about the hygiene in adults. So what are the types of toothbrush that we can use?
See, we would definitely recommend to use a soft toothbrush which causes less damage to your gums and surrounding structures. Many people are under the impression that if you use vigorous force or a hard toothbrush, it is going to whiten your teeth. But this is wrong. It in turn damages your gums and it causes irreversible damage to your enamel. Enamel is the hardest substance in your body. It is harder than your bone. So vigorous force using a hard toothbrush, it wears away your enamel. And if an injury happens to your skin or any other part, it heals on its own. Whereas an injury to your teeth does not heal. Once lost is always lost. You can only replace it with a filling or an artificial tooth material.
So is an electric toothbrush better? Because I've seen these electric toothbrush being used. So is that better than the traditional ones?
Studies show that there is no significant difference between an electric and a manual toothbrush.
Okay.
If used correctly, both are effective. But an electric toothbrush can be used in people with limited dexterity, like those recovering from a stroke or people with rheumatoid arthritis. Electric toothbrush can also be used by people who tend to use vigorous force, which in turn leads to wearing off of the enamel.
So doctor, how often should we replace our toothbrush?
See, a toothbrush must be replaced once in every 3 to 4 months, or as soon as it starts getting to fray.
So is there a best toothpaste which we can use, or is all the toothpaste advisable?
See, we usually recommend a fluoridated toothpaste for adults because it helps to remineralize and strengthen your tooth. And for kids, there are special toothpaste for the kids which has less burning sensation, and it's safe to swallow as well.
So doctor, I've heard that when people brush their teeth vigorously, it can cause bleeding of the gums. Is it normal?
See, occasional bleeding of gums is normal while brushing vigorously or by ill-fitting dentures, but frequent bleeding can be a sign of an underlying cause like gum infection, or it can be hormonal changes during pregnancy, or any bleeding disorders or vitamin deficiency, etc.
Yeah, so does it have any treatment? Should a treatment be done?
So the treatment for bleeding gums or gum infection is definitely maintaining your oral hygiene and dental cleaning. So what happens in gum infection is there is something known as plaque. So the debris from your food, the saliva, they all coat on your teeth, and this is known as plaque. When a plaque is left on your teeth, or if it is not cleaned frequently, it solidifies into something known as calculus. So this calculus causes bleeding of your gums, and it leads to gingivitis. And gingivitis, if left untreated, it progresses to a much severe form known as periodontitis. So what happens in periodontitis is your supporting structures of your teeth and gum, that is the fibers that hold your gum to the teeth, is weakened. So your tooth starts to get weak, or it starts shaking, and eventually it falls off. So gum infection, if left untreated, can lead to falling off of your teeth.
So doctor, we have learned about tooth scaling at school. So what is exactly tooth scaling and how is it important?
See, the process of removing the deposits or the plaque and calculus and the stains by a dentist is known as tooth scaling. Good oral hygiene and tooth scaling is vitally important to prevent gum infections. You need to get your tooth cleaned or checked by a dentist twice a year, or at least once in a year. Maintaining a good oral hygiene is the first step to prevent any gum infection.
So can this tooth scaling cause damage to our teeth?
This is one of the most common misunderstanding in the mind of a common man. Tooth scaling does not damage your teeth, it does not make your teeth weak, or it is definitely not harmful for your teeth. We would not do something which is harmful for a common man. So it in turn helps to improve your oral hygiene and prevent any sort of gum infection in the future. There are some cases where people say that, okay, I got some spaces after I got my teeth cleaned, or I have sensitivity after cleaning of my teeth. So what happens is, some people already have spaces between their teeth, which over a period of time is filled up with deposits known as calculus. So when a professional cleaning is done, these calculus is removed and those spaces are visible. This is what most people say, that I developed spaces after cleaning. And a mild sensitivity is sometimes seen in the first 24 hours after cleaning. This can be sorted off by using a sensitivity special toothpaste like Sensodyne or Colgate Sensitive Pro Relief.
So doctor, can the scaling of teeth help in the whitening?
Definitely yes. By scaling, we are removing the stains and deposits on the teeth. So this gives an initial effect of whitening. But if you want to see an improvement in the shade of your teeth, there is something specifically known as whitening treatment, which improves the shade of your teeth.
So doctor, I've heard that when the wisdom tooth arrives, that we need to remove it. Is it very necessary?
Wisdom tooth is your last tooth or the third molar, and it is the last tooth to erupt into the oral cavity. It usually happens after an age of 18, and in some cases, wisdom tooth can be completely missing. So, in some patients where the jaw is small and there is no sufficient space for the wisdom tooth to come, it can lead to pain and a small infection. So, in such cases, we advise that we need to extract the wisdom tooth. And this is done under local anesthesia, and it is a very minor surgical procedure. In some of the complicated cases, this can be done under general anesthesia as well.
So, okay, doctor, that's it for today. Thank you for taking your time off your busy schedule and coming here with us.
Thank you so much, Gauri, for having me over the BMC Global Live Health World. It's my pleasure to be here.
Once again, thank you, doctor. So, dear viewers, that's it for today. We had discussed about the oral hygiene in children, infants, as well as adults. So, thank you for watching BMC Global Live AL-HILAL Health World. I'm Gauri Priya here, and with us we had Dr. Rinkoo Jose. Please do not forget to like and share our Facebook page. Also like, share and subscribe our YouTube channel. Thank you and have a good night.